You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. Jeannie Roller and I are talking about healthcare issues that we find, that we've, investigated, that we have come in contact with. We've had ourselves procedures done that we can't believe. Some of the things that we've seen in the healthcare arena in different facilities and whatever. And try to bring those stories forward to try to get some help for people, maybe give you an opinion on what we did to try to help ourselves not have this happen to us again. And one of the subjects that we've talked about, Jeannie, you and I, a couple of times, is about health care and facilities for geriatric aged patients and what the percentages really are of things that happen to people in that age bracket that maybe don't happen to other patients in other age brackets. And it's just astounding. And of course, we have to also recognize that when you get to be older, you are going to, for the most part, have more procedures, be more involved in having medical care and those kinds of things when you get older. And why, again, can't you trust what's going to happen to you? Because you have just some staggering statistics of what poor care there really is out there and available for people in the age brackets of, I'm going to say, 50 and plus, Jeannie?
Yeah. Anything, I think they defined being geriatric in the hospital as being age 60. Some of them do so.
Okay.
This is about a lady who is 75 years old.
Okay.
At the time. She worked as a special education tutor. She had a bad fall, landed her in the hospital. Mm-hmm. She got her fall taken care of, and she got pneumonia. And she became confused and agitated, and she ultimately contacted a serious stomach infection while in the hospital. So she was in there 3 weeks in the hospital for the fall, all the related stuff, and then 3 more in rehab.
Just let me interrupt you for a second. What did she have? A broken hip or something like that?
It didn't go say.
Okay, it was just
it didn't really say what was broken. But
okay,
probably a hip. I mean, at that age.
Yeah, we don't know.
And then she emerged, weaker than before, shaky and unable to think. She wasn't able to, she had to stop working, and she wasn't able to drive. And now in this article, it says she's considering moving out of state to be closer to relatives for help. And this article goes on to say about 1/3 of patients over 70 years old and more than half of patients over 85 years old leave the hospital more disabled than when they arrived. As a result, many seniors are unable to care for themselves after discharge, need assistance with daily activities such as bathing, dressing, or walking. And a physician in this article goes on to say, the older you are, the worse the hospital is for you. And a lot of the stuff has to do with in the hospital, we kind of joke hospital food is bad. Well, a lot of times people don't eat. Mm-hmm. The other thing is people can't sleep in the hospital. There's noise, there's light, and of course they are constantly waking you up. Mm-hmm. So for older people, this is very dangerous. And Cindy, we've talked before about some of the medications, especially the sedation medications that they use, also play a role in this. A lot of times hospital staff fail to give proper care to the older patients. They fail to get them out of bed enough. They fail to control their pain. They may even fail to make sure they're eating. Right. So it is just a whole slew of things. Sometimes if you share a room with another patient, that patient will also keep you awake or disturb you. I mean, these things are maybe annoying for the younger patients, but for older patients, it can cause lasting damage that may never, ever go away. So, I mean, it is a very serious problem, and one that they know that they have, but yet it keeps happening. Bed rest can be really, really bad, especially if you have too much, because, I tell my mother, she's 92, if you sit in your chair, you're going to lose the ability to function because you're not going to be able to walk. You're not going to get out. You have to get up no matter what and get around. Yeah. And in the hospital, you know, there's not enough people there to help them.
Yeah. So, I mean, my opinions on some of this stuff is, and, maybe I'm going to be a little bit too caustic, but it is a fact, if you will, that when you start to get older, your systems are going to get more taxed and more, I don't want to say worn down, but for lack of a better word, maybe worn down kind of thing, just like an engine or something like that. So if you know that in the healthcare industry, why are you, if you know that the percentages of people that you're going to be caring for are in a higher age bracket, then what's the mindset with all of this? If you know that going into it, then why isn't the care just as good for that age bracket as any other age bracket? Do people think that because you're 75 years old, basically your time's up in life, and so, you just got to take what you get as far as what we're dealing out? I mean, I don't want to say those kind of things or even put those thoughts out there but is that what the mindset is? Why such poor care? I mean, I don't get it. Yeah.
Well, I mean, you said that, Cindy, and that's basically what one hospital system told me and my husband is get used to it. You're getting older, get used to the care that you call bad.
Why?
But, patients, there are more and more patients over 65 now. Mm-hmm. Yeah. Nearly more than 13 million seniors a year are hospitalized here in the U.S. Mm-hmm. So it is that is a lot of hospital systems' bread and butter are the seniors. Yeah. And, one bad hospitalization can push them over the edge to never being able to recover properly or even to function again if they're not careful, because, some seniors are already in a delicate position. So if they have all this going on, then they will tip them over the edge, and that's horrible.
I just don't get what the whole mindset of any of that stuff is. And I've said this 100 times, and I feel sorry for the people that are in healthcare doing the right thing by the right people, trying to give good care. Totally feel sorry for people that have to be in the same atmosphere and what they must think or what they endure to stay in the healthcare industry because they want to help people. Totally feel sorry for all of them. But this doesn't make any sense to me. It just doesn't. If you want to give good care to people, you give good care to everybody. I mean, that's what you do. It's never wrong to do the right thing. A friend of mine told me years ago, it is never wrong to do the right thing. So I don't get all of this stuff. It's so sad. It is so sad that anybody should be harmed going into the medical industry on purpose. I'm not talking about accidents. Accidents happen. We all know that people try to do the best thing when they try to do the best thing, and things do happen. There's no question about that. Absolutely none. And I know that emergency situations are totally different than all this elective stuff and whatever, but at the end of the day, every person deserves to have the care that they deserve to have as a human being. I mean, I don't know what the answer is. I'm kind of stumped for all of this, Jeannie. And I don't want to hear that this many people are harmed. I really just don't want to hear this.
Yeah. I mean, it's sad. I mean, this lady that we were talking about, she still has short-term memory loss. She's gotten somewhat better physically, but, and, you and I have talked about the short-term memory loss, sedation.
Yep. And when you get older, these powerful drugs are, how many times more powerful for your mind, your body, than they would have been if you were 25 or 18 or 40 or whatever. I mean, that's totally true. I mean, it just stands to reason. It just stands to reason. But wow, I don't want to hear another sad story. So again, you have to be your own best advocate. Bring in, try to get the best doctors that you can, because you do have a little bit of control of that. Maybe not always when you're in a hospital setting, because they have doctors that work there and whatever, so you don't have as much control there. But I mean, that's what I try to do in my own personal care. And believe me, I don't get it right every time. I don't. I mean, I've had my own stuff happen too. So on that note, I just have to say, be your own best advocate when you're in the medical industry and when you're in the, trying to get medical care in the facility. Stay tuned to Evergreen Media Network.